Do your feet burn at night when you finally lie down? Do your hands go numb for no clear reason? Or do you feel sharp electric pains that doctors struggle to explain? Stay with me, because what I am about to share could explain why your nerves are under attack and how to stop the damage before it becomes permanent. Welcome to my YouTube channel. I'm Dr. Robert. For decades, I've worked with seniors struggling with nerve pain, numbness, burning feet, balance problems, and a condition many are told they must simply accept: neuropathy. And here's the truth most people never hear. In many cases, nerve damage is not just aging, it's not always genetics, and it's often not inevitable. Today, I am going to explain the single most common poison damaging seniors' nerves right now, something millions are exposed to every day without realizing it. More importantly, I'll show you what actually helps protect your nerves while there's still time. Why nerve damage feels so confusing. One of the most frustrating things I see is how confused people feel when nerve symptoms start. It often begins quietly: a little tingling in the toes, mild numbness in the fingers, a strange burning sensation at night. Then the explanations come. It's probably age, maybe circulation, just something you'll have to live with. But nerves don't fail overnight. Nerves are living tissue. They rely on steady blood flow, oxygen, nutrients, and stable internal chemistry. Unlike skin or muscle, nerves heal very slowly. That means damage builds silently for years before symptoms show up. By the time pain appears, the problem has often been developing for a long time. The real poison attacking senior nerves: when people hear the word poison, they imagine chemicals or toxins. But the most damaging poison for nerves today is far more common. It's chronic blood sugar exposure, and this is critical. You do not need diabetes for blood sugar to harm your nerves. Repeated spikes are enough. When blood sugar rises too high, sugar molecules bind to nerve fibers and the tiny blood vessels that feed them. This creates inflammation, oxidative stress, and damage to the protective coating around nerves. Over time, nerves lose their ability to send clean signals. That's when symptoms appear: tingling, numbness, burning, sharp pain, balance problems. This process doesn't announce itself. It works quietly in the background. But my blood sugar, isn't that bad? This is where many people get caught off guard. You may have been told, your sugar is a little high, you're borderline pre-diabetic, but nothing serious. That's often exactly where nerve damage begins. Research now shows that nerve damage can develop during prediabetes nearly as often as during full diabetes. The difference is awareness. Most people with prediabetes don't know what's happening. They feel symptoms but don't connect them to blood sugar. Where these sugar spikes come from, let's talk about everyday habits that quietly harm nerves. First, liquid sugar. Fruit juice, sweetened coffee drinks, sports drinks, and smoothies flood the bloodstream with sugar because there's no fiber to slow absorption. Seniors are often told juice is healthy and gentle. In reality, liquid sugar creates some of the fastest blood sugar spikes, and nerves pay the price. Second, refined carbohydrates, eaten alone. Bread, cereal, crackers, rice, pasta, especially when eaten without protein or fat, break down into sugar very quickly. Easy to digest often means rapid sugar release. Third, constant snacking. When insulin stays elevated all day, nerves never get a recovery window. This constant exposure keeps nerves inflamed and vulnerable. Medications and hidden nutrient loss. There's another layer many people never hear about. Certain medications can interfere with nutrient absorption, especially vitamin B12. B12 is essential for maintaining the protective coating around nerves. Without it, nerves become fragile and misfire. Acid blockers, some diabetes medications, and cholesterol drugs can quietly deplete B12 over time. The damage doesn't happen overnight, but it adds up. Neuropathy is rarely caused by just one factor. It's usually a combination of blood sugar toxicity, inflammation, nutrient depletion, and circulation problems. But blood sugar is often the accelerant. The good news: what actually helps. Now let's talk about what gives you control. The goal is not perfect blood sugar. The goal is stable blood sugar. Every sharp spike acts like a small chemical burn to nerve tissue. Fewer spikes mean less damage and sometimes slower or halted progression. Here's the most important true light: each seniors with nerve problems never eat carbohydrates by themselves, not fruit, not bread, not cereal. When carbs are eaten alone, sugar enters the bloodstream too fast. But when paired with protein or healthy fat, absorption slows dramatically. Same food, completely different effect. Simple changes that protect nerves. Here are practical steps that many seniors can follow. Eliminate liquid sugar entirely. Eat fruit only in small portions. After meals, pair all carbohydrates with protein or healthy fat. Walk gently for 10 minutes after meals. Ask your doctor to check B12 levels. If symptoms exist, this isn't about extreme diets or miracle cures. It's about removing what is quietly harming nerves and giving them a more stable environment to survive. Why stopping progression matters. Nerve damage is slow to heal, and sometimes it can't fully reverse, but stopping progression is powerful. Less pain, better sleep, improved balance, fewer falls, more independence. Tingling and numbness are not verdicts, they're warnings. The earlier you act, the more nerve function you can preserve. Anyone promising a miracle cure for neuropathy is not being honest. But anyone saying nothing can be done is also wrong. There is a wide middle ground, where real improvement lives, and it starts by removing the poison. If this video helped you understand what may be happening in your body, I encourage you to keep learning. Watch the next video on my channel to discover how to identify hidden blood sugar spikes and protect your nerves after 60. Subscribe for more clear, science-based health insights designed specifically for seniors. Your nerves matter, and protecting them starts today.